Assalamu alaikum. Welcome back to Dr. Tariq RYK. Today our topic is about the anatomy of the upper limb or bones of the upper limbs. In this we will see all the bones of the upper limb, but now we will see the humerus or also known as the arm. So let's see separately humerus. This is the humerus on right side. Humerus basically is the long bone. It consists of two heads and shaft. If we see a humerus from anterior view, it will be like this. If we see like posterior view, it will show like this. And if we see from lateral side, humerus will be like this. And if we see its medial aspect, we will imagine like this. And if we see from the head side or superior side, the humerus will be like this. And if we see inferior or lower side, we will see like this. So let's start from the anterior view. We will see all landmarks of the humerus because humerus is very important in clinically. See from proximal to distal. Proximal, we see the head of the humerus, that is the ball shaped and spherical shape. It fit into the socket like cavity of the scapula to make the glenohumeral joint or ball and socket joint of the shoulder. This is head of the humerus. And here is a anatomical neck of the humerus. Humerus has two neck, anatomical. This is the surgical neck. This one is the anatomical neck. Anatomical neck is the area between the head and the surgical neck. And this is the lesser tubercle. This is the greater tubercle or tuberosity of the humerus. And this is the intertubercle sulcus. And here is a surgical neck. The surgical neck is very important because the most of the fracture of the humerus occur through this line or the surgical neck. And here is a crest of the lesser tubercle, and this is the crest of the greater tubercle. This is the shaft of the humerus. This is the deltoid tuberosity. Deltoid tuberosity is the part of the humerus where the deltoid muscle get insertion, and very important because it helps the deltoid muscle to make the upward or the abduction of the arm. In this, the deltoid muscle help in the abduction of the arm. It is about 15% of the total abduction of the arm. And here is a anterior surface of the shaft of the humerus. Here is a anteromedial surface. And if we see the distal side, here we will note condyles of the humerus. This is the trochlea. This is the capitulum. These are the two bony protrusion of the humerus. They attach with the ulna. Here we see the epicondyle, and here is the lateral epicondyle. Here is medial epicondyle. Here is lateral epicondyle. And this is the coronoid fossa for the coronoid process of the ulna. And here is radial fossa for the radial head. And here is lateral supracondylar ridge. Ridge is basically this is the lateral supracondylar ridge. And here is medial supracondylar ridge. This is the anterior of the humerus. If we see the posterior view of the humerus, we will note this is the posterior view of the humerus. You can see in the proximal, this is the head of the humerus, and here is a greater tubercle of the humerus. This is the shaft of the humerus. Here is radial groove through which the radial nerve pass, and here is deltoid tuberosity again. And in the distal part, here is posterior surface of the humerus, and here is olecranon process of the olecranon fossa of the humerus, and here is medial epicondyle, and here is lateral epicondyle of the humerus. This is the posterior view of the humerus. If we see from lateral side, this is the lateral side of the humerus. Laterally, humerus look like this. This is the lateral view. Here is deltoid tuberosity. Deltoid tuberosity is on the lateral side of the humerus. See, this is deltoid tuberosity, and here is the insertion of the deltoid muscle. This is the anterior lateral surface of the shaft of the humerus. Now see from the medial surface of the humerus. This is the medial view of the humerus. We will note some features of the humerus or critical points. Here is again head of the humerus, and medially here is medial supracondylar ridge, and here is medial epicondyle of the humerus. If you see from the superior or cranial surface, we will see the humerus like this. This is the superior view of the humerus. This again is the head. This is the anatomical neck and the surgical neck, and again a shaft. If we see from the inferior view, humerus will be like this. This is the humerus from inferior view. This is the medial epicondyle. This is, and here is capitulum. This is the trochlea. Here is posterior surface, olecranon fossa, and here is medial epicondyle. Humerus in proximal, it connects or articulate with the glenoid cavity of the scapula, where it make the shoulder joint or the ball and socket joint. And in the distal part, humerus join with the radius laterally and the ulna medially, make the elbow joint. This is the distal part of the humerus, and the trochlea join with the ulna, and the capitulum join with the radius. This is the all about the humerus. If you have any question about the humerus, you can make comment. Thanks for watching. See you for next. Allah Hafiz.